When it comes to maintaining a fit and healthy life, we all know that what we eat plays a crucial role in our overall well-being. But if you have been diagnosed with fatty liver, it is even more important to pay attention to your diet and make necessary changes to treat the condition. While there are many foods that are beneficial for your liver, there are also certain foods that can worsen your condition. In this video, we will discuss the 5 liver-damaging foods that you should strictly avoid or limit if you have fatty liver. These foods not only aggravate the symptoms of fatty liver, but can also increase your risk of developing more serious health complications. So, without further ado, let's dive in and learn about the foods to avoid for a healthy liver. Number 1. Added sugars. If you have been diagnosed with fatty liver, one of the first things you should do is cut down your consumption of added sugars. Foods and beverages with free sugars offer empty calories without providing any nutritional value, which can lead to weight gain, insulin resistance, and fatty liver. But why is added sugar so harmful to your liver? Well, one of the main reasons is fructose. Fructose is a type of sugar that is commonly used in processed foods and drinks. When consumed in large amounts, it can cause insulin resistance, oxidative stress, inflammation, elevated uric acid levels, increased blood pressure, and higher levels of triglycerides in your blood and liver. All of these factors can contribute to the development or progression of non-alcoholic fatty liver disease, NAFLD, which is characterized by excess fat accumulation in the liver. One of the major sources of fructose is high fructose corn syrup, which is commonly used to sweeten sodas, candy, cereals, baked goods, and other processed foods. High blood sugar levels can also lead to other serious health complications, such as type 2 diabetes and heart disease. Therefore, it is recommended to stay away from sugary foods and drinks if you have fatty liver disease. However, if you have a sweet tooth, you can opt for healthier alternatives like fresh fruits or natural sweeteners like honey or maple syrup in moderation. This way, you can satisfy your cravings without causing harm to your liver. Also, be sure to check the ingredient list and nutrition label of packaged foods for added sugars, as they can often go by different names like corn syrup, sucrose, glucose, and more. Number 2. Alcohol. Alcohol is one of the biggest causes of fatty liver disease, and excessive consumption can lead to serious health complications. When you drink alcohol, the liver's job is to break it down into energy and eliminate it from the body. However, when your liver becomes overloaded with alcohol, it cannot properly metabolize fats, resulting in a buildup of fat in the liver. This can lead to liver inflammation and damage, causing fatty liver disease. In fact, even just a few days of heavy drinking can cause fat to accumulate in the liver, which is known as alcoholic fatty liver disease, the first stage of alcohol-related liver disease, ARLD. But alcohol doesn't just affect your liver. It can also increase your risk of other health conditions like high blood pressure, heart disease, and cancer. If you have been diagnosed with fatty liver disease, the first step to treating it is to abstain from alcohol completely. Even small amounts of alcohol can worsen your condition and make it harder for your liver to heal. While in some cases, it may be possible to reverse the damage done by alcohol on the liver, it is important to note that this may take months or even years of complete abstinence. Therefore, if you have fatty liver disease, it is crucial to avoid alcohol or drink in moderation. The recommended limit for moderate drinking is 1 alcoholic beverage per day for women and 2 for men. But keep in mind that this can vary based on factors like body weight, age, and overall health. Number 3. Processed and packaged foods. Well, who doesn't love the convenience of packaged snacks and frozen meals? They are easy to prepare, taste delicious, and, most importantly, save us time. But, as the saying goes, convenience comes at a price. And in this case, it is our liver health. Processed and packaged foods are often high in unhealthy fats, added sugars, sodium, and artificial additives. They also lack essential nutrients like fiber, vitamins, and minerals that are crucial for maintaining a healthy liver. These foods can contribute to weight gain, insulin resistance, and liver inflammation, which can worsen the symptoms of fatty liver disease. They can even increase the risk of developing more serious liver conditions like cirrhosis and liver cancer over time. The reason behind this is that when the liver is not functioning properly, it cannot break down and eliminate these harmful substances from the body efficiently. As a result, they can accumulate in the liver and cause damage over time. Some of the most common examples of processed and packaged foods that should be avoided include processed meats, like sausages and hot dogs, packaged snacks like chips and crackers, frozen meals, fast food, and more. By cutting down on these types of foods, you can reduce the burden on your liver and give it a chance to repair itself. If you don't want to completely eliminate these foods from your diet, you can opt for healthier alternatives like homemade versions, or choose options with lower amounts of unhealthy fats or sugars. Number 4. Saturated and trans fats. When it comes to maintaining a healthy liver, it is also important to pay attention to the types of fats in your diet. Saturated and trans fats are two types of unhealthy fats that can have a negative impact on your liver health. These fats can increase the cholesterol levels in your blood and promote inflammation in the liver. This can lead to the development of fatty liver disease and other serious liver conditions. Saturated fats are commonly found in foods like fatty cuts of meat, poultry with the skin, and high-fat dairy products like whole milk, palm oil, cheese, and butter. Trans fats, on the other hand, are often found in fried foods, commercially baked goods like cakes and cookies, snack foods like chips and crackers, and some margarines. If you don't want to make your liver work harder, it is best to avoid or limit these types of foods in your diet. Also, check food labels for partially hydrogenated oils, as they are an indication of trans fats. Instead, opt for healthier options like lean cuts of meat, skinless poultry, low-fat dairy products, and plant-based oils like olive or avocado oil. Additionally, coconut oil also contains saturated fats, which were earlier thought to be harmful to health. However, recent studies have shown that these saturated fats are short-chain and can actually be beneficial for liver health. Coconut oil is rich in phytonutrients and polyphenols, which have anti-inflammatory properties and may help reverse fatty liver disease. Number 5. Salty and fried foods. The last food on our list that you should strictly avoid if you have fatty liver disease is salty and fried foods. Consuming too much fried or salty food can increase your calorie intake and lead to obesity, which is a common cause of fatty liver disease. The high sodium content in these foods can also contribute to fluid retention and increase the risk of liver damage. The recommended daily limit for sodium intake is less than 2,300 milligrams per day, and people with high blood pressure should limit it to no more than 1,500 milligrams per day. Fried foods are also high in unhealthy fats, which can worsen liver inflammation and contribute to the development of fatty liver disease. Some common examples of salty and fried foods to avoid include French fries, potato chips, fried chicken, processed meats like bacon and deli meats, canned soups, pre-packaged meals, and salty snacks like pretzels. So it is best to read food labels and choose alternatives with lower sodium content, or prepare meals at home using fresh ingredients, herbs, and spices for flavor. By making these small changes to your diet, you can significantly reduce the strain on your liver and improve its overall health. While these 5 foods are the main culprits that can worsen fatty liver disease, there are also some other foods like white flour, red meats, and sugary drinks that should be limited or avoided for better liver health. It is also essential to note that a healthy liver diet should focus on maintaining a balanced and nutritious diet, rather than just avoiding specific foods. Eating a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can provide essential nutrients to support liver function and overall health. Additionally, managing your portion sizes and maintaining a healthy weight can also help improve liver health. It is always best to consult with a healthcare professional or registered dietitian for personalized dietary recommendations based on your specific needs and condition. With the right diet and lifestyle changes, you can take control of your liver health and prevent or improve fatty liver disease. We really hope this video has given you valuable insights into the foods to avoid for a healthy liver. If you find it helpful, don't forget to smash that like button and subscribe to our channel for more informational content. Until next time, cut down on these foods and take care of your liver. Take care of your liver.